Hi, I'm Dr. Steve Nielsen, and I'd like to ask you for a few minutes of your time so we can review a little bit about wearing masks. There's a lot of talk about whether you should wear a mask or not. At this point, I'm not going to get into that discussion, wear it or not wear it, but there's a lot of misuse of the masks, and I'd like to just give you some thoughts of how to wear a mask so you can be more effective in your protection and the protection of others. First of all, in our air, there's a lot of things that we can't see floating around, or in this case, we can see some pollen floating around from this tree. Here's a nice picture of Los Angeles where you can see the smog that's hanging over the city, which is not an uncommon thing in Los Angeles. But if you're right in the middle of the city, you really don't see that much until you get back away and see the whole picture. So there's contaminants that we have in the air that are particulate, or there's biological matter in the air as well. When we take a look at this picture, this guy breathing into his hands on a nice cold day, you can see how far his breath actually extends. You realize that as we breathe, that the moisture in our nasal passages and our sinuses help to moisturize the air before it gets to your lungs to protect your lungs. And then as we breathe out, we're breathing out some of this moisture. And that's an important consideration when you're thinking about wearing masks. First of all, how far does your breathing actually extend as you're just normal breathing? And also consider that this moisture from your own breath going out into your mask as you're breathing out is going to moisturize the inside surface and eventually penetrate through to the outside surface, which will decrease the effectiveness of your mask because you have that moisture passing through. And so that's a consideration if you're wearing your mask for quite a while, that you may need to change it because it's becoming ineffective. Here's an interesting shot from, this is a YouTube video from January of 2014 from ABC World News. They did a study, and this sneeze that they're showing here, they registered at 11 feet that there was particulates there. So that's a good reason to be wearing a mask, because if you cough or sneeze, you're forcefully putting your bacteria out into the air and associated with your saliva. And as a practicing dentist for 40 years, I've been up close to saliva and blood and infection. And in the early days of my practice, we never worried about masks or glasses or gloves. But after the HIV infection, then we all of a sudden started learning that we needed to do some different things. What we started doing is what we called universal precautions. These universal precautions meant that we would act as if every patient we had in our chair had hepatitis. And if we treat every patient the same, then we can protect from infection spreading from patient to patient. You can imagine if I were to see a patient and not change my gloves and start seeing you as the next patient, that you wouldn't be very happy about that because of my glove contamination. But that's another subject. But if you consider in your mind that you treat everyone in the environment around you as having something, it could be pneumonia, COVID-19, it could be a myriad of diseases that is spread through the community through aerosols coming out of your mouth and your nose. So what I'd like to do is take a look at some masks. So here I have some masks. Here's a homemade mask. Notice that one side is dark and one side is light. That's important because as you put your mask on, if you put it on so that the white side is always to the inside, and then after you take it off and go do something else, that you don't put it on backwards, because then you've got a contaminated surface. You have to assume that that gray surface, after you've worn it now, has done its job and it's protecting you, so it has on its surface contaminants. So if you have those contaminants on the surface of that mask and you're doing this, which I've seen happen in medical offices, somebody, the front office staff will wear their mask and they'll sit and look at their computer like this, or they'll wear their mask. I'm going to switch to a surgical mask here. You see a lot of times surgical masks are worn down like this or even down like this. And that's not a method by which it'll do you any good. In one medical office I went into, they were wearing, the front office staff was wearing their masks like this, and as we came in the door and approached them, they grabbed their mask like this and then held it like this so that they were protected from me. But recognize their hands were probably contaminated. So there's two things that you got to consider. The surface of the mask is going to have contaminants on it, assuming that there's contaminants in the air and you're breathing. If you touch it with your hand, you will pick up contaminants, biological problems onto your hands. Also, if you don't have clean hands and you're touching your mask, you're going to contaminate the surface and increase the risk of you getting that into your mouth. That's like sticking your finger in your mouth. So a key is put your mask on by the strings. Don't wear it down on your neck. And if you wear it down there like that, then you want to put it on your mat, put it back on, put it on like this. Not like this. When you initially put your mask on, make sure you do have clean hands so you're not contaminating, and try and keep your fingers on just the strings. Now, I'm going to talk about a concept of good, better, and best. So this is good. This is going to give you some protection. And these are pretty good too. You notice there's a difference between these two surgical masks. As you turn around the inside here, get it turned around the right way, this particular mask has a foam liner across the top. This one does not. And as you start wearing masks, you're going to find when you put these masks on, if you're wearing glasses like me and you pinch that down, you're going to get steamed glasses. So you want to wear your glasses down over your mask a little bit like that and pinch it down. And if you have that foam liner across the top, it's going to work a little bit better for you. And then you'll get caught in your glasses like that. Now, the best, supposedly, mask is this N95 mask. Notice it has two strings. It's thicker, it's heavier, and it has a seal across the top of the nose, too. But notice when I put it on, that I've got the straps. I've got two straps. I'm going to put this one down over my neck and keep the other one up high. That keeps me pretty tight up against the nose there, and around the cheeks, whereas those surgical masks don't. Now, I do have some colleagues who have 3D printers who are making little frames that fit over your face. So for these surgical masks, it will literally tighten down over the face like that. Not with your hands, but there's a 3D printed frame that can fit down over the top of that. And you can find those on YouTube. And if you have a dentist friend who has a 3D printer, he may be able to make one for you. So those are good, better, and best masks. But if I take my very best mask, my N95 mask, and I put it on again, notice I'm holding it by the straps. A little harder to put on, a little harder to talk, a little harder to breathe. And if I'm using it such and I pull it down like this so I can talk or breathe a bit easier, and I handle it with my fingers, what's happening to the mask? Or what's happening to my hands? Those are the kind of abuses that you see daily throughout wherever you go. You see it in Walmart, you see it in medical offices, you see it even in public places like the media. Let me show you a couple of little clips of things I picked up off the media. Okay, this is a meeting with President Trump, and you notice as he took off his mask, he just took it off and wadded it up in his hand. Let's go back and take a look at that again. Okay, here he is taking off his mask, and he's just wadding it up in his hand. His mask is probably contaminated, and he's got it on his hands now. So even though he was told there was no COVID positive persons in the room and he felt like he was comfortable taking his mask off, he's getting contamination in his hands from just the way he handled it. So even if that would have been a high-end mask, like a N95 or something like that, that contamination just ruins the whole thing. And all of a sudden, you don't have that kind of protection, and any protection you may have had has just gone out the window. In this video, this is recently in the Rose Garden, you see this reporter. She's got an N95 mask on. She only has one strap, and so to help hold it up, she's holding it over her face as she talks. So kind of defeating the purpose. Then she pulls it down on her neck, and not really happy with President Trump at the moment. But the point of the matter is the effectiveness of her mask has just gone out the window. Now she's trying to adjust it and put it back on her face, and doesn't cover her nose with it either. So those kind of things we see daily. So key issues are, we'll just go quickly review. Have clean hands when you put your mask on. Hold it by the strings. Always wear it the same side to the inside. Adjust it over your nose. And don't touch your hands to your face. Don't touch your hands to your mask. Don't wear it down on your neck. And lift it up like this. Get masks that fit and you can wear and wear appropriately. If you think this video was helpful, please like it, comment, and share it with others. And maybe we can get through this and actually have masks that are doing us some good.